Let's talk about how to help your patients feel more comfortable and more confident after their breast cancer surgery. It's well documented that patients often lose sensation and feeling in the breast and chest area after mastectomies. You see, these life-saving surgeries remove as much of the cancer as possible, and in doing so, they can often disrupt nerves in that area, including the thoracic intercostal nerves and the supraclavicular nerves. These nerves, which previously supplied sensation to the chest, no longer communicate that information to the central nervous system, and sometimes that change is permanent. Regardless of whether the sensation loss is temporary or permanent, it can have serious implications for your patient, including pain, increased risk of injury, issues with intimacy and body image, as well as decreased quality of life. Let me be clear, this is a deeply bothersome experience for many of your patients, and it's your job to help them feel their absolute best so that they can get back to doing the things that are important to them. This summer, I worked with a patient who was preparing to go on vacation with her family. It was one of their first family vacations since she has gotten done with her breast cancer treatment, and she was really excited about it. But she was also really nervous about it because ever since her breast surgery, her nipples are basically always erect, and it makes her feel self-conscious. And those flimsy swimsuit pads that you get don't cut it. On top of that, because her sensation is still pretty absent after last year's breast cancer surgery and then reconstruction, she was worried about wardrobe malfunctions happening and her not even noticing it. That's where these came in to save the day. A few months back, a company called CAKES sent me a few of their samples to try out. And per their website, CAKES are the first grippy bra inserts designed for everyday life, including swimming, working out, lounging around, and more. So I grabbed a pair, gave them to my patient, and then gave her explicit instructions to wear them and then give me a full detailed report when she got back from vacation. And here's what she loved about CAKES. CAKES gripped like a champ. CAKES are grippy and not sticky. So most bra inserts on the market these days are sticky, meaning they have some kind of adhesive, and that's how they actually stick to you. However, CAKES are different because they're made to adhere to the skin with the body's natural body heat. That meant my patient didn't have to rip them off when she was done wearing them, which leads me to the next thing that she loved about CAKES. They didn't irritate her skin. Especially for your patients with more delicate skin after breast surgery, reconstruction, and even radiation therapy, adhesives can cause skin reactions or even rip off skin during the removal process. And this is the last thing that your patients need when their body is trying to heal. CAKES are made with 100% medical grade silicone, which means that they are adhesive free and they're much more gentle and safe for your patients, like I said, especially for those who have more delicate skin after breast cancer treatment. Quick interruption. Have you ever tried CAKES? Let me know in the comments because I'm always looking to see what other people think about the products I recommend. The next thing my patient loved about CAKES is that they did not budge with swimming or sweat. One of my patient's biggest fears about going on vacation was getting in the pool to play with her children and then her swimsuit top shifting to reveal a wardrobe malfunction without her noticing. With her CAKES inserts, my patient had the confidence to get in the pool to play with her kids without worrying that her swimsuit top was going to move around and potentially expose her because she had that backup modesty cover in case of malfunctions. CAKES does recommend that if you are swimming fully submerged in the pool, that you actually take the CAKE inserts and put them inside the swimsuit top rather than on your skin, because that water may impede the insert's ability to really stick to the breast tissue here. However, because my patient wasn't going to be fully in the pool submerged for long periods of time, she chose to wear them just as normally instructed directly on her breast tissue, and she was able to play around in the pool and again did not have any problems with them slipping, with them falling off. They stayed there for the whole day while she was out in the pool with her kids. The next thing my patient loved about her CAKES is that she can reuse them again and again. After my patient returned from her fabulous family vacation, she was so thrilled with how the CAKES held up while swimming that she couldn't wait to actually use them for her daily workouts. She's now been using them both in her runs as well as her daily yoga practices to help combat the constant nipple erection that she faces that makes her feel so self-conscious. Even with the sweat and constant motion, her CAKES are staying in place during her daily workouts under her sports bra. Best of all, they're washable. So after she's done with her workouts, she will wash them with warm water, pat them dry, and then they're ready for the next time she wants to wear them. So after hearing my patient rave about CAKES so much, I figured I should probably try them too. And what better way to test them than the incredibly hot and sweaty summers of Texas? So I used my pairs in the throes of the Texas summer when I wore my Barbie outfit to the movies. And the hype holds up. Even with all the sweat, my cakes were like the Dyson of bra inserts. They weren't moving at all. I then loaned my cleaned and washed pair to my friend who forgot her birthday outfit bra. And she loved him so much, she took him home with her. So happy birthday, I guess. I truly did love my cakes so much that I will definitely be buying a pair or two for my own personal use in the future. Cakes come in 3 sizes to accommodate a range of cup sizes, from itty bitty to OG to plus. And as of the time of this recording, cakes come in 3 different colors: cocoa, caramel, and honey. But I'm hoping to see in the future that they even offer more colors to be more inclusive of a variety of skin tones. And with my discount affiliate code, OncoPT, your patients and you can save 10% on your purchase from Cakes. And perhaps coolest of all, $1 from every purchase goes to support the Breast Cancer Coalition and the Previvor, which obviously makes this OncoPT very warm and fuzzy on the inside. Thank you so much to Cakes for sending me your great products. I have tremendously enjoyed trying them out. I've been really impressed by the patient feedback that I've gotten, and I'm looking forward to sharing them with more of my patients in the future. Because if my patients love a product, then I'm a believer. If you're someone who wants to learn even more about addressing your patient's impairments after breast cancer and breast cancer treatment, then make sure to watch this next video where I'll show you how to apply cake tape to feet with chemotherapy-induced peripheral neuropathy. Thank you so much for watching this video, and until next time, this is Elise with the OncoPT. And remember, you are exactly the physical therapist that your patients with cancer need. So let's get to work.